everyone.
Yeah, first woman dentist in Cuba.
A female power baby.
Oh, let's skip that for a minute.
Dental Crews, I'm very excited to introduce Regency Square Dental, where a buddy of mine, RJ, is here practicing with his family. We all love a family-owned practice. Let's go check it out.
Hey, welcome to our office, Regency Square Dental. This is Stacy, our smile girl.
Hi, welcome.
Our two office managers, Nat and Jenny.
Hi.
We just recently remodeled the whole office, so this is our new front desk.
One of the best parts about this practice, in my opinion, and what you don't get to see a lot, is that it is a family practice. So I would love to introduce the main doctors, no offense, RJ, who really have created this dental home.
So I'm Dr. Martha de la Iglesia. I have been doing dentistry for a long time. This is part of my life. I love it. We talk about dentistry all the time. Not only with my husband, but with my children and with my cousins and with my family. This is part of my life. This is my husband, Ray. You want to introduce yourself, Ray?
I'm Ray, I'm her husband.
Dr. G. Dr. G.
I'm Dr. G. I'm not a real doctor. I'm the surgeon in the house. All I do here is surgery, you know. But yeah, I mean, we've been around now for 37 years. It's been definitely a family practice with us too. And then we had the honor of having my son join us in almost 2 years now, along with his better half, Stephanie. They're actually the reason why we've redone this office the way we have. I mean, we were here in this location for 17 years, and we've totally redone this office thanks to them.
So we have 13 operatories here at Regency Square Dental. We have 4 hygiene ops, and the rest are surgical suites and general dental ops. So come on by, let's show you a few of them here. This is our general dental suites here. We have a couple rooms here, our hygiene room over here. And then down this way, we have 2 consult rooms here for our treatment planning presentations, and just, we do a lot of implant consults. We see a lot of all-on-X patients and whatnot. So we bring the patients in here, kind of introduce ourselves, the office managers introduce themselves, and we really get to know the patient before we start talking to them about what we're about to get into and offer them all the options in these consult rooms. So this is our newest consult room. And over here we have our other consult room with all the family diplomas. And we are a family practice, so we have mom, dad, myself, and my girlfriend currently working here at the office. This is our CS9600 CBCT machine. It's a brand new state-of-the-art cone beam CT. It does everything you can think of. It even has a facial scanner on it. We can do 3D facial scans, CBCT, pano, all of that stuff. We're gonna take you over to our surgical suite. This is our main surgical suite over here, where we do a lot of the all-on-X surgeries, soft tissue surgeries, implants, all that good stuff. I love surgery. Yeah, I mean, I've always known that I like surgery. Ever since dental school, since before dental school. I went into a residency that was very surgical heavy. And so I got a lot of implant experience and surgery, perio surgery experience and whatnot in residency.
Nice.
So, and obviously working with dad, doing a lot of all-on-X stuff, got a lot, even more experience out here.
The boss man.
Yeah, exactly. This is our newest surgical suite here with our Ray Face facial scanner. Since we remodeled, we added a second sterilization area here. So these are all newer machines. We have a wash here. So this is our lab, or the start of our lab. So we have 3 lab techs here. We do everything from clear aligners, night guards. We have a ton of 3D printers. I mean, I can't remember the last time I took an impression or an alginate impression, because we just scan everything nowadays. So this is where everything starts. This is where we do a lot of the night guards, liners, and we have 4 CEREC MCXL, so we can do same day veneers, same day crowns, multiple crowns rather than just one. So this is our milling room and our dirty lab. So this is where we do all the zirconia milling, some Emax milling as well. But these guys are working all the time, getting our zirconia hybrids milled, zirconia crowns, things like that. This is very clean right now, but it normally gets real dusty. So
No, that's awesome.
we try to keep it clean, but it is.
They did it just for you guys, Dental Crews.
Just for you guys. You want to do a facial scan?
Yeah, let's do it. I want that. Oh God.
This is basically a 3D picture of your face. So just like when we do intraoral scanning, you're gonna get like a 3D model of the mouth. Well, this is gonna do a 3D model of your face so that we can merge that into exocad with the model onto your face, so we can kind of not only just see a 2D picture, and that doesn't really show you a lot, we can move your face around in the computer and actually see the design of the smile that we did.
It's like
See what the
having-
teeth are gonna look like.
Yeah.
In your face, not just on a 2D picture or something.
Right. And it's nice because you can work with the patient without the patient being there.
Exactly.
Right.
Correct.
Yeah.
Come close, right there.
Okay.
Right
Yeah,
there,
perfect.
perfect. Look straight at the camera. Put your hair behind your ears so that we can see the ears.
You want me to smile?
And then you want to
I
smile.
see your teeth.
Right. Okay, so
Like
straight
that,
ahead.
smile?
That's
Yeah.
perfect. Over here. And let me do another one. Okay, so now if we just take that picture that we just took, we can
Look at that chin, huh? Double chin, long, elongated. Guys, you can't do this to a female. This is torture.
So what it's doing now is it's reconstructing the images that it took into a 3D. You are in
Oh
3D.
my god. It's so
A little
weird.
uncomfortable seeing your face.
The inherent problem with digital all-on-X is the accuracy of an intraoral scanner going across the arch. That's the problem. And it's mainly in the lower arch because of all the soft tissue that we have that just moves around. In the upper arch, you have the palate, right? So you can get pretty accurate on top. On the bottom, you rarely get it perfectly accurate. So that's where photogrammetry came along, and it gives us the exact position of the implant. It's not giving us tissue, it's not giving us anything but the exact position of the implants.
Yeah. So let's.
All right, so let's show you how this pick thing works. So you've got these flags that are dominoes, and they're like dominoes, and the points are all in different positions. They're all numbered. You have to put them a specific way, right? And then when you turn the camera on, what you're going to see here is I'm going to be shooting onto the dominoes, and this is going to start picking the position. Okay, so you hold that. This is the actual camera, and as you see it picked them up. It's registering them, and there it captured the 3 implants. So now this is showing me the exact position of those 3 implants that we just scanned. This now gets exported and sent to the lab, and they will merge this with the other information we've given them so that we can have, the idea behind this is to have a totally passive fitting set of teeth. Because the one thing that'll cause these implants to fail is something that's not passive in the mouth. Will cause the implants to fail. So with this, we can now achieve perfect pacificity. Is that the right way to say it?
Wait, cool little fun fact actually. Not only do we have my parents here, but this is also my grandmother painted this. So that's kind of a cool little fun fact about our office. It's kind of like a modern dental, you can see the teeth in there and whatnot, but she's an artist, so she did a lot of like art for our office here. She also painted this one here. My great grandmother was actually the first female dentist in Cuba. So that's dad's mom, or dad's mom's mom.
It's amazing to work with family because now we're seeing second generations, third generations coming in. And when they see that we have...
That just means we're getting old.
Yeah. When they see that we have kids that have followed us, the reaction from our patients is so amazing. They're like, oh my God, your son, it's finally here. And we've been talking about it for a long time. And they're working. I can't believe he's so big. They saw me pregnant with a belly, and now they see them as professionals. So it's really awesome to see your patients bring their kids, their grandchildren, and now my children, treating their children. It's awesome. I think it's great.
Thanks for watching another episode of Dental Cribs. Like and subscribe if you want to see more content. And if you're interested in being on our show, let us know. And as always, thank you to our sponsors, ADEC and Patterson. You all make this possible.